Hi, I'm Gene, and welcome to AssessMinutes, where we take a complex assessment topic and break it down to make it easily understandable, because minutes matter. Often, as teachers are reviewing reports from STAR Reading and STAR Early Literacy for students up to the 4th grade level, they will come across and call in about the estimated oral reading fluency score and ask, what is this and what am I supposed to do with it? To help you understand that, let me give you a little bit of background. First of all, in the early grades, it has commonly been a practice to directly have students read things aloud for you and to produce a score, words correct per minute, on what they're doing. The whole use of fluency really sprang onto the scene in the 1950s when we realized that often fluency is tightly correlated with comprehension. In other words, it's typical that when a student can read something aloud with fluency, then in most cases they also comprehend what they are reading. So in that sense, fluency is a proxy for comprehension, because measuring comprehension more directly can quite easily become more time-consuming. So, STAR Reading and STAR Early Literacy tests are direct measures of comprehension. So, in the same way that fluency measures can say something about comprehension, it's very easy to see how comprehension measures could say something about fluency. Now, through the use of this score, we are not saying that you should not have students read aloud fluently. That's a critical activity with an early grades classroom. But what we are saying is you can get some new insight. Now, let me give you a little history about the score, and then we'll talk about how you can use it. The score was developed a number of years ago when we had a very large sample, in fact over 12,000 students that we collected data on, and they took both a STAR Reading or a STAR Early Literacy test and a Dibble's Oral Reading Fluency Probe. And what we did is we tried to see how tightly the two scores were correlated. And what we found is exactly what we suspected. They are very tightly correlated. You see the correlations on the screen, both graphically and in numerical form. So what you see is very, very tight correlations that, as the grades progress, become a little bit less correlated. Now, this is not something unique to STAR. This is unique to all assessments. Through a variety of assessment researchers have demonstrated time and time again that as the students progress through the grades, sometimes we have students who are really good at reading aloud fluently, but they don't necessarily understand or comprehend what they are reading. This becomes the case when students become so good at decoding that they can, again, read with fluency and not understand what it is they're necessarily reading. And this is the exact reason why beyond 4th grade, we do not report estimated oral reading fluency, because as students go through the grades, the link between oral reading fluency and comprehension begins to decline or erode. So some kids are so good at reading aloud, but they still don't understand necessarily what they are reading. In this case, they would have a higher directly observed oral fluency and a lower estimated oral reading fluency, and that's something that would tip you off about what's happening with a student. The opposite is also true. Sometimes there are some kids that just aren't very good or comfortable with reading things aloud. For them, you will see a lower directly observed reading fluency level and a higher STAR test score, letting you know that even though they don't read aloud with as much fluency as you would expect, they are indeed comprehending what they read. So, two measures, both addressing within the same area. If they line up, what you suspect is confirmed, and if they are off, if they are producing some differences, that could offer to you some new insights.